Assalamualaikum and hi, I'm Dr. Juliana Yusof. I'm an ONG specialist from Faculty of Medicine, Hospital UiTM. I'm honored to give my talk on effectiveness of WhatsApp in obstetric and gynecology teaching and learning. So as for introduction, teaching and creating analytical thinking among medical students to become good future doctors are definitely not an easy task. Deep teacher approach is required to train these medical students. And one of the deep teacher approach that has been studied was the use of mobile application. WhatsApp is one of the commonest apps used in mobile application. And in order for the efficacy of WhatsApp as a teaching tool, at least one designated moderator is needed. So the objective of the study is to determine the medical students' academic performance in ONG posting following WhatsApp teaching. And for the research questions, they are: does WhatsApp teaching influence the medical students' exam grade better? Number 2, does WhatsApp teaching influence the medical students' marks better? Number 3, do female medical students achieve better grade than male medical students? So as for literature review, these are the journals that I took. Number 1, one of the idea was teacher-centered approach, of which I took this idea by journal written by D. Vasundara Devi back in 2015, of which this journal mentioned that students actually prefer teacher-centered approach. And the second idea was to identify the efficacy of WhatsApp among slow learners, among medical students, of which this study was done by Nanda M in 2019, whereby actually the study revealed that there was drastic academic improvement among medical students who are slow learners in ENT posting after WhatsApp teaching. And the third one was I would like to study on the preference of online versus face-to-face preference, whereby I took this study by Preston G, a paper in 2010, whereby actually it revealed that 70% of students preferred online rather than face-to-face teaching. For methodology, this was a descriptive cross-sectional study involving medical students in ONG posting for the batch 2015, 2016 and batch 2017 and 2018, with a total of 321 students, of which for the non-WhatsApp teaching, there were 123 students versus 199 students in the WhatsApp teaching group. So what does the dedicated ONG lecturer do in WhatsApp teaching? Number 1, we put up assignments for the medical students to answer and correct the assignments. So as you can see, this was the assignment that we put up, and this was the case write-up that we have corrected online. Number 2, we perform viva or quiz to the medical students related to the ONG topics. Number 3, we ask medical students to clock patients in ward with good clinical findings. Okay, as seen in this WhatsApp note here, WhatsApp chat here. Number 4, we actually correct their bedside teaching notes and share in the WhatsApp group. So this is the picture of a bedside teaching notes done by my medical students, which I have corrected on the whiteboard, and I will ask them to share the corrected notes in the WhatsApp group so that other colleagues can get further knowledge. And for number 5, I correct their case write-up and also share in the WhatsApp teaching group. Okay. So as for the results, the first table here shows the status of the medical students, the grade of the medical students following WhatsApp teaching versus non-WhatsApp teaching, of which actually the p-value was 0.213, which was non-significant. However, if you go to table 2, these are the marks achieved by medical students following WhatsApp and non-WhatsApp teaching, of which most students actually achieved score of 61 to 65 in the WhatsApp teaching group, compared to marks of 56 to 60 in the non-WhatsApp teaching group, with a p-value of 0.026, which is significant. So as you can see here, I've highlighted that in the WhatsApp teaching group, 15 medical students managed to score distinction. As for table number 3, this table shows the gender factor and grades, whereby, as you can see here, obviously the female medical students scored distinction higher than the male students, and the p-value was significant with the value of 0.049. So this picture shows the histogram of which the mean marks achieved by the medical student for ONG posting was 60.3, whereby majority of the students actually scored marks of 59, which is actually a grade C. So as for discussion, what are the benefits of WhatsApp teaching to the medical students? Number 1, it provides communication or sporadic learning opportunities, whereby this will actually improve learning, especially among these slow learners, by creating their interest and improving communication and relationship among medical students and lecturers. Alright, for example, the clinical lecturer can actually upload video on intraoperative findings of a patient after the patient's consent has been obtained to be shown to their respective medical students. So this is the example of intraoperative findings that I have shared to my medical students in 2018. As you can see, the picture on my left-hand side is the laparoscopy findings of my patient with stage 3 endometriosis. And on the right-hand side is a hysterectomy which I had performed, of which when I cut through the uterus there was an endometrial polyp. So I've showed this to my medical students, and by showing these intraoperative findings, it will enhance their understanding, and my aim is that they can score to answer the OSCE in their future exam. So what's the advantage of WhatsApp teaching? With the advance of modern medicine, there are changing demands and expectations of the skills that doctors will need to master, which are deeper thinking and critical analysis. And these are important elements needed when facing complicated clinical cases, of which there was a study done in Uganda in 2019 revealed that WhatsApp has a great potential to support development of higher order thinking skills or HOT among university students. So I would like to show the students' performance after WhatsApp teaching. Alright, so this was one of my students in 2018. Now she has graduated and became a medical doctor last year. Okay. The second one is the medical student who managed to score distinction. And the third one are my medical students who managed to pass the ONG posting. Alhamdulillah. So as for conclusion, each medical lecturer is actually encouraged to use WhatsApp as one of their teaching approach, especially in this pandemic COVID-19 era, where medical students have limited access to cloud patients, hence the ability to create analytical thinking among them is further hampered. and it is our duty as a medical lecturer to educate medical students as much as we can, since this noble effort indirectly will help to improve the Malaysian health system by providing good quality doctors in the future. So these are my references, and with that, I thank you and stay safe away from COVID-19. Assalamualaikum.